2012, the headlines are full of talk about hospitals and how health care is paid for. The landmark Supreme Court ruling on President Obama's Affordable Care Act brings more questions and clarity. This year, 3 North Carolinians are being honored for their leadership in challenging financial and political times. These 3 share the virtue of courage and a passion for quality in their organizations across North Carolina and beyond.
You know, when he came into the state, it's sort of like the wind blowing here. He sort of blew into the Department of Health and Human Services and made sweeping changes in the division and in the department.
He's a CEO's absolute dream for a board chair because he understands health care. He's engaged in the community. He does all the right things to help. And this was his avocation, was this hospital, and has been and still is.
A lot has to do with Tim's willingness to kind of step outside anybody's comfort zone and to do what's right.
The North Carolina Hospital Association is proud to honor these 3 individuals. An accountant who became a leading legislator, served North Carolina Health and Human Services both as deputy director and director, and currently consults internationally on health care management. A 36-year veteran trustee who helped rescue a struggling rural mountain hospital on the verge of bankruptcy to become a forerunner in affiliating small rural hospitals with larger healthcare systems. And a pharmacist who has grown a good medium-sized hospital into a nationally recognized multi-hospital system with top-of-the-line staff, policy, and technology. All 3 have significantly impacted healthcare in North Carolina. Lanier Cansler, former Secretary of North Carolina Health and Human Services, is the 2012 recipient of the NCHA Meritorious Service Award.
The thing about Lanier that's so terrific is that he's the whole package in terms of what you would want an elected or an appointed official to be like. He has leadership skills. He also has the management skills that are so important to underpin accountability and be able to document what you're doing and why it works and why it's important.
He sort of blew into the Department of Health and Human Services and made sweeping changes in the division and in the department. He wanted to make sure that in doing so, that all the divisions within the state in the entire department would work together and not work individually in silos.
In Health and Human Services, there's 260-some programs that we manage. And there's 230-some IT operating systems that were developed. Each time we develop a program, we develop a system to help manage it. They seldom talk to each other. But generally, people who are served by one program within the agency are probably served by a number of programs within the agency. If we have someone that has an intense need right now, but we examine them and we say, okay, if we do this and this, we can help them become more independent and reduce their need for services, and in the long term it's going to save us money while creating a better quality of life for them. So the whole approach of trying to integrate the services and trying to look at the whole person rather than pieces of the person, I think is a policy approach that we've implemented in Health and Human Services the last few years that is really one of the things I'm most proud of.
He's got that sixth sense about what's going to work and what's not going to work from a political perspective. But he also is incredibly collaborative.
That means sometimes you reach across the aisle and you try to work on things that you believe are important. The CHIPS plan, Health Choice for North Carolina, was a good example of that. Republicans controlled the House, Democrats controlled the Senate, but worked closely together in trying to develop a program that would work for North Carolina, and turned out to be a national model in the health program for children.
Invited to speak recently in Taiwan, Cansler saw good health care at half the cost of the U.S., but also found that our systems are unique.
If you look across North Carolina, over 65 of our counties, health care is in the top 5 employers, and then in the top 10 in 80-some of our counties. And so it's not something you just say, well, we're going to take the knife to. We really have to plan a transition and figure out how we maintain the access to care and the quality of care, but do it in a more cost-effective manner. And I think there's a lot of things that we can do to get there, but it's got to be something that everyone decides that we want to do it, because I think there's a way. We got to create the will.
When Secretary Cansler came into his role as the department secretary, it was in one of the most challenging times in North Carolina. For 3 straight years, we had to find ways to lower our cost, and it was very difficult to do so throughout our division. But when you're one of the largest divisions, that's where the money is, and that's where they expected reductions. So we had a challenge to balance quality, but also at the same time, making sure the reductions he made would not hurt care for the citizens of North Carolina.
Lanier Cansler is a CPA who understands the complexities of health care and sees the financial handwriting on the wall.
As the federal government begins to squeeze its budget and the state government continues to squeeze its budget, be it State Employees Health Plan or Medicaid or the CHIPS program, that puts more and more pressure on providers, and quite honestly, it continues the effort to shift costs to the commercial and private pay. And there will be a point that that won't work anymore. We're paying twice per capita for health care than any other nation. And we've got to find some ways to start reducing that cost because it's not sustainable in the long haul. And I'm hopeful that I can work with folks to be a part of designing a transitional plan on how to do that as opposed to just waiting to see what we get.
Richard Montague, a 36-year Blue Ridge Regional Hospital board chairman, is this year's recipient of the NCHA Trustee Merit Award. Richard Montague's father was a founder of the Spruce Pine Hospital. Young Richard was there for the groundbreaking, and you could say he grew up with the hospital. Richard also grew up in the Spruce Pine mica business, where his company provides high-technology components to the aerospace industry. Beyond his business obligations, Richard Montague has steadfastly provided experience and wisdom to the NCHA.
He's maintained a hospital, helped maintain a hospital in a community that's small, rural, and this hospital has been recognized as a top 100 performance improvement hospital in the U.S. So he's helped guide all that. So he's clearly deserving of it. Plus, I think I'm correct in saying that Richard's probably the only trustee that has ever served twice on the Hospital Association board.
Again, the way he's driven our hospital, the way he's passionately been committed to it, has brought good people on to help him serve. I think he's got to be a model for any trustee in any rural hospital across the state.
Probably the most challenging time was the late 80s, where hospital reimbursements had changed and the practice of health care had changed, and to be honest, our hospital was practically bankrupt.
We've always believed that we have to deliver a certain quality of service to our patients, and we were delivering the service, but the revenue wasn't keeping up with the expenses that we were incurring. We were having trouble meeting payroll.
They literally would have declared bankruptcy had they had the money to pay the lawyers. Richard hung on. He was the board chair at the time.
But when I talked to the lawyers, they said, well, send us a check for $20,000 and we can start the proceedings whenever you want. And hey, we can't afford to do that.
The story goes that at one point we were in doubt about meeting our payroll for the week, and Richard stepped up and said, if the hospital can't meet it, I'll take care of it.
If that had been necessary, which on the day before I was going to bring Charles a check, the day before we got a check in from the Medicare that was owed us, and so that prevented us need. But there was a time there where, basically we were the backup if necessary. But
he had foresight. We were one of the first hospitals which to integrate or it'll become affiliated with a larger hospital.
There's got to be a better way and a different way to do it, and that sort of gave us the impetus to rebuild ourselves and work with other hospitals. It was about that time we made some affiliations with Mission Hospital.
There was all of us involved, but he led us through that process, which allowed us to affiliate with a larger hospital in 1997. That's almost 15 years before it's now in vogue to do that, because of the rural hospitals need access to capital. They need to be able to have some expertise that they can't afford in some cases, but we've been at this for a long time.
I think the future of this hospital is really bright. We've got an exciting new young CEO, a super physician staff, nursing staff, administrative staff, and to build a hospital that serves the health care needs of this community. And I think we're well on the way to doing that wonderfully.
And Richard Montague, 36 years on the Blue Ridge Regional Hospital Board, still passionate about the work.
Well, for one thing, it's one of the most challenging things you can become involved with. Even a small hospital is a complex organization. As one person has said, the two most complex organizations in the world are hospitals and aircraft carriers. And there is so much going on, so many things that are involved every day, the daily interaction between the patients and the staff, and also it's the opportunity, while being able to serve the community, to really do some good, but is what it boils down to.
R. Timothy Rice, Chief Executive Officer, Cone Health, is the 2012 recipient of the NCHA Distinguished Service Award.
Oh, I think there are many, many reasons Tim deserves this award. He's a fabulous leader and has made a tremendous impact not only on our community, the state, and now nationally.
His work ethic, I call it the Tim Rice full court press, really kind of helps him to rise to the top. He really is the kind of person that you want as a citizen in your community. He's the kind of person that you want leading your organization. He's articulate. He's a consensus builder. He's just an overall good guy.
One of the things I love about Tim is he's passionate, he's got a lot of courage, he's very high energy, and he is not afraid to make a hard decision if it benefits patient care. For an example, he decided that we would be one of the first health systems to require mandatory flu shots for employees, which protects our patients. And it was not a uniformly popular decision at the time, but it was the right thing to do, and now many others have followed lead.
Or having started here 34 years ago in what was a tertiary hospital, nice size hospital, now 5, becoming 6 hospitals. We've spread our footprint so far. We've grown because we've done a good job of what we do, caring for our communities. And so in a large part, we've had others come to us and say, how can we partner with you?
We were one of the early health systems to eliminate tobacco use on campus. Our health system was one of the very early adopters, again, on an electronic ICU where all of our patients across the health system are monitored 24/7. So it raises the bar on patient care, and we've really seen great benefits to that. But it was a tremendous investment of personnel and resources to implement that.
And what I would say about Tim is that it really is more about mission than it is about self. So the thing that really is the major difference now is a changing culture in our institution and increasing trust between physicians and other providers and the administration.
The biggest challenge we face right now is the unknown. With a tremendous amount of budgetary pressures at the federal level and at state levels, with a lot of cuts, with a lot of pressure on hospitals and other providers to change what we're doing, to bend the cost curve, to use a common phrase, where we're spending way too much on healthcare today.
He has a unique ability to listen and to be, he's got a great combination of being intuitive and leading edge, but also a detailed person. So I think others certainly have had the opportunity to benefit from his knowledge.
As I've gotten more involved at the national level with the American Hospital Association or the Joint Commission, I've come to appreciate even more how good our hospitals are in North Carolina. We have very collaborative relationships. Even where we have competitive local competition, we still exchange best practices. We still work to do the right thing for our communities and for our patients. What's going on in the delivery reform right now, we believe will continue to drive that way. What I'm referring to is a change from a volume-based system to a value-based system. So we've got to provide better quality, do it at less cost, and really be concerned about the outcome of the care.
He's very fun-loving. He knows everyone. That is one of the many strengths, to have a system of over 8,000 employees and have a CEO that knows many, many people, because he's been here for 30 years.
I know. Thank you.
You have,
Dr.
you have
Dana,
to email
yes.
that to me. Email that.
Oh, yes.
One phrase in our values is about having fun. What we do is very serious work, day in, day out, life-saving work, but we also have that word fun in one of our value statements. And I try to impart that to what I do. I try to bring fun to what I do. I try not to be the stuffed suit for staff. I try to be a real person, and most people know me as one of the folks here.
We have really set a high bar, so I'm very proud of his leadership.
We've grown so much, and yet I still feel very comfortable with the people that I started here with 30-some years ago. It's all part of my family.
Lanier Cansler, Richard Montague, and Tim Rice. All three have significantly improved health care in our state. The NCHA salutes them for their courage, dedication, and leadership in advancing the quality and value of health care for North Carolinians.